Response to the coronavirus pandemic means providing help for everybody, but also having everybody take precautions. We hear that from public officials over and over, and it's a message the city is taking additional steps to get across to immigrants who live in Boston. To tell us about the messaging and various forms of help is the director of the Mayor's Office of Immigrant Advancement, Yusufi Vali. Thank you very much for being with us, Yusufi.
Chris, it's wonderful being here with you, even though obviously the times are difficult.
Yes, and I hope you're getting through those. I want to ask you about the challenges that are faced by immigrants, and I know that overlaps with a lot of other factors. But what do you see most of all here in Boston?
Yeah, I think great question. First of all, I want everyone of your viewers to know that Mayor Walsh and our team here is working hard every day to make sure all of our residents are feeling healthy and also safe. And right now, a big focus of our administration is to ensure that all of our vulnerable folks really have the supports they need. So our homeless, our older residents, first responders, frontline workers, and our immigrants. This comes out of, Chris, you know the mayor, he's got a big heart, but it also is just the smart thing to do right now, right? Our most vulnerable are the ones that either are at most risk or have the least resources. And to ensure the public health and safety of everyone in this time, we need to make sure that literally no one contracts this thing. And so, and the best way to do that is to focus on vulnerable who don't have the resources that some folks do, right? And so it's the right thing to do, but it's also the smart thing to do to focus on our vulnerable. And getting to our immigrants, the challenges that we're facing are, our immigrant population at this point, which is good portion of Boston's immigrants are really working class. In fact, 57% of foreign-born Boston residents, family income is actually 300% below the poverty line, right? So they are certainly being impacted, but the other way that immigrants are being impacted here is they're actually in the front lines of this crisis. So 12% of foreign-born Bostonian workers are actually working in the healthcare industry. So they're helping us fight this COVID-19 thing. And that is compared to 8% of native-born Bostonian workers working in the healthcare industry. So proportionally, they're at a higher higher percentage that are working in the healthcare industry and fighting this thing. So they're impacted in a couple of different ways, our immigrant population is.
Well, I can see a lot of the people you just mentioned, they can't work from home. They have to go someplace to do that. And on the way there, they might not have their own car. So I guess that's a challenge too, isn't it?
Yeah, I think look, across the board, I think transportation's a challenge. Food is certainly a big challenge. There was a potential for housing being a major challenge. And then just needs around, general assistance, right? Diapers, hygiene products, those kind of pieces. Those are the stories that we've heard. And so the city's strategy in terms of supporting our immigrants and really supporting all of our vulnerable residents has been first and foremost a focus on food. We're distributing close to anywhere between 30 to 46,000 meals out to our most vulnerable residents. And what we're trying to ensure really is make sure that the immigrants are a core part of that strategy, and they are. We've leaned a lot in the resiliency fund to fill in any gaps there are, and you probably saw that community servings and Fresh Truck got some contracts. You're going to see some more investments, particularly in immigrant nonprofits, to also get food to some of those hard to reach immigrant residents, right? Then on the housing side of things, you've seen the mayor call for a 90-day eviction moratorium, right? So that people can stay in their homes. And we launched a rental relief fund just this past week that is particularly geared to ensure that our very low income immigrants and folks that just aren't going to have any income, that they're supplemented by the city on that. And lastly, on general assistance for diapers, for hygiene products, those kind of things, we're going to again lean into the resiliency funds, and there's a number of funds that have popped up in the region that we're going to lean into to provide this population with support.
Of course, when I picture immigrants and immigrant success stories, I think of entrepreneurs or people who work long hours in these sort of contract jobs. So you got people who are just put out of business temporarily, we of course hope, and people who might have trouble collecting unemployment because they don't have quite the right eligibility. What's the city doing for immigrants who have those challenges?
So you're 100% right. I mean, so many of our small business owners are immigrants, entrepreneurs, and really working class folks. So on the smallest business side, the city's launched a $2 million fund that the mayor again launched last week, and just encourage your viewers to call 311 and ask for information for that, or go on to boston.gov/coronavirus, and you're going to find information on the small business piece, the rental relief piece, all of the information that you need on that. So that's a big piece. The other thing I'll just share is that we are really, particularly my office, is working hand in hand with our immigrant nonprofits. We're hosting weekly webinars because we know that they are so well connected to folks on the ground. So this past week, we held a webinar on food access because we heard that food was potentially a challenge for our immigrant residents. This week, we're actually hosting it on the Resiliency Fund, and for people to understand how to apply for that, and potentially also on the Rental Relief Fund, how to access that. And we're going to keep on coming and partnering with different agencies around webinars that begin to educate folks on how to apply for the CARES Act unemployment piece. So that's our strategy around this, and that's the work that's being done at this moment.
Of course, the most critical need for everybody is healthcare. We have recently heard all the way up from to people in Washington that if it's related to COVID-19, the government will pay for it. Don't worry about the cost. But then questions come up in people's heads. Is this for all people who live in this country? And how do you prove it's for COVID-19? Do you have to take a test? And what if you can't take the test? Do you worry about that?
Great question, Chris. And I want to be crystal clear on this point to your viewers, and I really ask their help in getting this information out. Regardless of your status, regardless of your paperwork, here in Massachusetts, you will get health care if you have COVID-19. COVID-19. You need to go and call the doctor, and doesn't matter whether you're documented or undocumented. You have access to health care during this time around this particular virus. And if you have any confusion around that, call the mayor's health line. Just call 311 and ask to be connected there. But I will tell you, if you're undocumented, you have access to it. Again, I want to repeat that. And again, just the best thing you can do is call your doctor to figure out the details of what you were mentioning in terms of how you in terms of whether you have it or not, etc. I mean, that's always the first step, right? But if you're worried about qualifying for it, just call 311. They'll correct you to the mayor's health line, or call Healthcare for All. So I hope I'm being absolutely as clear as I can on this, Chris, because I understand that there's been confusion. But in Massachusetts, folks will qualify. And frankly, this is just good public policy to ensure the health and safety for all of us, right? Because if there is one person out there that is walking around and has the virus and is infecting others, that's just not good. And so Massachusetts, we've done the smart thing here, ensuring that everyone has access to health care for this particular virus.
We should emphasize here, because I know you, in a way, have answered the questions that we were thinking of earlier about the public charge rule, because the government has since sort of retreated on that temporarily during the emergency. But I think the other challenge here is for people who don't have internet. They need to talk to somebody like a doctor. Not everybody has that connection. So maybe we should emphasize one more time, how can they get on the phone and get some help?
Yeah, just call 311 and ask for the mayor's helpline, and they're going to guide you through the whole process. I actually have the number here for the helpline if you want to dial it directly. It's 617-534-5050, 617-534-5050.